On a analysé la place du secteur privé.
We analyzed the role of the private sector in the healthcare system in 25 OECD countries. A new study by IRIS, a research institute that analyzes public policies and the Quebec economy, revealed that countries with greater private presence in healthcare have higher mortality rates and lower life expectancies. Based on 25 OECD countries, the research shows that the average life expectancy for people living in countries that have elevated private healthcare systems is 81.6 years old, whereas those in countries with very little private healthcare have a life expectancy of 82.7 years.
C'est 27% des dépenses totales de santé au Canada.
Private spending accounts for 27% of total healthcare expenditures in Canada. This means that people have to pay either to purchase healthcare services or to pay for insurance in areas such as physiotherapy, mental health, long-term care, and medications. All of this leads us to believe that if we choose to further privatize services in Canada, it will be even more detrimental to the health of the population. The researcher who conducted this study, Anne Plourde, raises concerns about the amount of surgeries going to private clinics in Quebec.
Il y a principalement au niveau des chirurgies.
Primarily in the areas of surgery, the government wants to increase the use of private clinics for surgical procedures. According to the latest estimates, 19% of surgeries are now performed in for-profit private clinics. A few years ago, no surgery was outsourced to the private sector, so there has really been a great deal of privatization in that respect. While there are concerns about the rise in private healthcare, Paul Brunet, the chair for the Council for the Protection of Patients, says that in Quebec, private clinics that do work for the public sector have agreements that ensure a certain standard of care.
A lot, if not the majority, of private clinics who do surgeries have to sign an accord with the CIUS or the CIS involved, or even the ministry, and then they are subject to a lot of control, a lot of surveillance, a lot of, monitoring of what they do, because it's like subcontracting for the CIS and CIUS. Of course, they are involved, and the accords are pretty detailed in terms of their responsibilities.
Il y a aussi, depuis le début de la pandémie,
since the start of the pandemic, there has also been a growing presence of for-profit private telemedicine platforms where doctors collaborate with other healthcare professionals. These are paid platforms, and that too poses a significant problem. In Montreal, Gareth Madoc-Jones, City News.